Okay, so what is the definition of bioethics? If you go through, you can find different definitions. The science of moral duty, a set of concepts and principles that guide us in determining what behavior helps or harms sentient creatures. And there are other definitions, but it's not the definition what's important, it's what it is, the bioethics. And why we need it. And I believe that doctors and other health professionals are facing everyday ethical dilemmas, and sometimes they even don't know that there is a dilemma. And I would like to give you some examples of dilemmas, typical dilemmas that we are facing, and sometimes we don't think that this is a dilemma. And I will just give you several descriptions. And dilemma number one, you are a surgeon, and 1 year ago you operated a 47-year-old lawyer who underwent right hernioplasty. The operation was complicated by wound infection that required hospitalization for another 3 days. In the lawsuit against you, the hospital reached a compromise and paid a high price. Now, what are you doing? The patient has hernia in his left groin, and he asks you to operate him again after he sued you several years ago. So this is a question that you have to face. Another dilemma, a new drug for cancer is on the market. The drug is very expensive and was not included in the basket. You go over the literature as a physician and you found only one small, not blinded, clinical study that showed positive results, but it was conducted by the drug company. All the other randomized control studies were negative. Would you recommend the expensive drug to your patient? You know that the basis is not strong enough. And then another dilemma. An 85-year-old woman with 4 children. She has diabetes, hypertension, ischemic heart disease, cognitive decline, Alzheimer's. She needs help with daily functioning. She has caregiver 3 days a week. And she had rectal bleeding, and a diagnosis of metastatic colon cancer was made. The family asked you not to tell about the diagnosis because her husband died 5 years ago from similar cancer after a long and difficult struggle. The rationale is that there is no treatment anyway to her disease, and therefore knowing about the disease has no practical implication, and it is just going to cause her depression for the rest of her short life. So what should you do? Is it legitimate not to tell the patient the truth? Another patient is a 35-year-old male and has recently been diagnosed with AIDS. He is in a close relationship with his girlfriend who does not know about the disease. He does not want to tell her about his illness because he is afraid that it will affect her attitude to him and their plans to get married. What should you do? And another dilemma. You asked as a physician to participate in a study that compares the effects of 2 antihypertensive drugs on cardiovascular endpoints. During the first months, all patients will receive a placebo. You know that 1 month of uncontrolled blood pressure may cause some damage. What should you do? A soldier was stabbed by the terrorist in the old city of Jerusalem. The soldier was seriously wounded in the chest. The terrorist was shot by another soldier and seriously wounded. The soldier and the terrorist were taken together to the same emergency room in your hospital. Both arrive in the same time, and maybe the terrorist is in a more serious condition. Who will be treated first? It's not easy dilemmas. So doctors and other health professionals are facing everyday ethical dilemmas. They had little training in how to deal with these ethical dilemmas, and that's why we need a bioethics and law center in our faculty. We must teach our students. We must have a center that will guide us how to deal with ethical dilemmas. We have to start from medical and health professional schools and continue in the hospitals, and this will be done by the Bioethics and Law Initiative in the Sackler Faculty of Medicine. So thank you very much and good luck.